So I'm going to try to, limit it to what I think is most important, and then if there's any additional questions, we can go into those. Especially I want to get to I think the interesting thing about stroke is when you have interruption of blood flow to a particular part of the brain, it causes a particular set of symptoms. And I think that's what's really interesting about at least just understanding how the brain works by itself. So we talked about how different parts of the brain are involved in different functions, and this is where you really see this come out when you have a stroke. So, so just a definition, it's an interruption of blood flow either from the blockage of blood vessel or from bleeding of a blood vessel. So an ischemic stroke is where you have a blood clot. So as the blood is going into a particular part of the brain, you have a clot. Versus a hemorrhagic stroke, which is in fact, often caused, let's say, by an aneurysm or the bursting of a blood vessel, and you have bleeding that goes throughout the brain. And that's what's on this model up here is the hemorrhagic stroke, where there's bleeding on the brain. But in fact, the hemorrhagic ones are, obviously, they're much more, I guess, clear and present. But the most common, in fact, 80% of strokes are actually the ischemic type. So where you have a blockage of a blood vessel. So this is just a little, let's see if this works. It's the blood flow to the brain, which I thought would just be interesting to show. And there's no audio or anything else. Bigger. So I'll be the audio. It's only about 2 minutes. So again, the heart, it does have some audio, I can read that. The heart pumps the blood to the brain. So obviously, it spreads out to the body, but then there's the carotid arteries that go up into the brain. And in the base of the brain, there's a nice set of the main blood vessels. So blood carries oxygen needed by the brain cells. So the blood is bringing all the food and nutrients that your brain will need. It travels to the brain by the cerebral vessels, or basically the arteries bring blood into the brain, and the veins bring it back. So the left middle cerebral artery, that's often one that really gets damaged in strokes. The carotid artery is obviously the main main artery from the heart. So the middle cerebral artery supplies the lateral portion of the brain. And the deeper structures of the brain, such as the caudate nucleus putamen and internal capsule, which I'll talk about, but those are essentially motor parts of the brain. So you can imagine that if you have an interruption of blood flow right here, you're going to cut off all the oxygen, all the nutrients that go to this part of the brain. So responsible for movement up in here, responsible for sensation over here. So I like this one because it really shows a nice close-up view of where the neurons are in the brain, where the blood vessels are, the red blood cells carrying the oxygen into the brain, and that neurons crisscross all these vessels, and they'll pull out oxygen, they'll pull out nutrients from those arteries, and then feed the neurons. So again, you can imagine that if you cut off that, or that if you interrupt that blood flow to those neurons, they're not getting their food, and they start to die off. So that was just something. So again, I think this is kind of interesting too, to think about how much blood goes into your brain. So blood flow to the brain is typically 750 milliliters per minute. So it's 15% of your heart's output goes to your brain. So your brain is it's kind of a pig. 50 to 54 milliliters of blood per 100 grams of brain tissue. So that might not mean anything, but what I think is worthwhile to just compare it to is not any of this. I'm going to kind of jump over this. So actually, tissue death occurs if flow dips below 8 to 10 milliliters per 100 milligrams. So it's really, it has to really drop down pretty significantly. But an ischemic event is when it dips down to 18 to 20, so about half of the normal blood flow. And then when you get to, about a quarter of that, that's when you have tissue death. So that's when your neurons are really starving and they're not getting their food, they're not getting their oxygen. So remember that, 50 to 54 milliliters. So blood flow to the brain, 15% of cardiac output, 50 to 54 milliliters of blood. At rest, your muscle blood flow maybe 1 to 4 milliliters per minute per 100 grams. So again, your muscles are obviously, they get a lot of blood flow. And this is, I'm not sure if this is total, all the muscle in the body, or just a particular muscle, but you can see again, just as a you know, as a big comparison, you know, 50 milliliters versus 1 to 4 milliliters per 100 grams of muscle tissue. So again, your brain is a hog. It's taking up a lot of blood, of a lot of cardiac output. So if your muscles are now fully active, and this is at rest. So I mean, again, your brain is probably never at rest. And you know, again, you think about the idea that we only use 10% of our brain. Well, it's probably always being active. It's not 10% because it's taking up a lot of blood. So maximum blood flow for muscle is about 50 to 100 mils per minute. So that's when, let's say, you're running full speed. So maybe a hockey player skating down the ice is getting about 50 to 100 mils per minute of blood to their muscles. So again, just starting to get to the level of what the brain needs just to be able to, you know, function at rest. Oh, I said that already. So there we go. So 15% goes to the entire brain, 20% goes to the entire muscle system. So there's a lot of blood that goes into the brain. So your neurons are always needing this blood. So you can imagine that if you cut off that blood supply, how much, you know, trouble you'll actually run into. So an ischemic stroke. So this is what I had said at the beginning. 80% of strokes are the ischemic type. So they're not, you know, like I said, I think this is more of the Hollywood stroke, the hemorrhage, that you see the bleeding on the brain that's very clear and present, but in fact it's more of the blockage of blood flow to the brain that will cause most strokes that we see today. So interruption of blood flow to the brain due to blood clot. So this is where we get, you know, again, this is why I don't want to get really into too much into prevention, because we all know all the bad things in our lives that can cause, you know, blockage of blood vessels. So either, you know, things from fatty acid or fatty materials, so, you know, Big Macs and French fries and all the good stuff in life, or just a narrowing of the arteries, which sometimes is a bit more of a genetic contribution, and that's something that I'll touch it more on when we get to multiple sclerosis, because that has, it's an interesting aspect about multiple sclerosis that people are saying that it's a narrowing of the veins that are actually draining the brain of its blood flow. So there's a lot of work that's looking at how these arteries, are, at least for a stroke, are narrowing and then cutting off the blood supply. So there's two types of these ischemic events. So there's the thrombotic strokes. So blood clot forms in an artery leading to the brain. So it could form, let's say you could have a clot in your heart, but there's a buildup of plaque in your heart, and then that travels up the carotid artery and goes into the brain and forms a clot as the arteries are narrowing. Or an embolic stroke. So that's where the, oh, I'm sorry, got them mixed up, of course. Thrombotic stroke is the clot within the brain itself, and the embolic stroke is a clot developing somewhere else in the body that then travels to the brain. So again, that's 80% of those strokes. So that's where we see, you know, as that video was showing, the middle cerebral artery going out, feeding this part of the brain, feeding these motor centers, feeding these sensory centers, and so you get a clot that forms there, or narrowing of that blood, of that artery, and so then the blood can't flow through properly, and those parts of the brain get starved of their oxygen, starved of their nutrients, and start to die off. So the transient ischemic attack, this is what I was talking about in terms of the concussions, but any of us can probably experience these mini strokes throughout our entire lives and we never even know. So it's caused by a temporary interruption of blood flow to the brain. And again, there's the warning signs, which I'll get into a little bit later, but they go away within a few minutes or hours. So you could have a headache and, you know, not even think about it, and it goes away, but it could have been because of a mini stroke. Did you have?
Is that dementia? Does that cause dementia?
Does it cause dementia? So I think what will often happen is, yes, if you do have a lot of these mini strokes, you can actually have degeneration, and that's, I mean, so that, you know, talking about risk factors for, let's say, Alzheimer's, factors that, you know, happen or causes or outcomes after a concussion, these mini strokes could actually be a big factor in that, and you wouldn't be able to actually detect it. So there we go. So many people can have these transient, you know, mini strokes without even knowing it, and it does put one at risk for, you know, real strokes, like the real full-blown stroke, but also puts people at risk probably for the development of dementia Alzheimer's, just the long-term degeneration of the brain that's associated with some of these other disorders. So again, comparison of a full-blown ischemic stroke to the mini stroke or the transient ischemic attack. You have the artery temporarily blocked. You have temporarily reduced function of that part of the brain. So you could, again, it could be as mild as a headache. It could be that you feel numbness in your hand. It could be that you lose, probably not total paralysis, but just a little incoordination. But then it goes away. No big deal, nothing you can really do about it. But again, what this can often do is if you have lots of these, if you do have these little blockades, you can imagine is that then it really gets fully blocked, artery becomes completely blocked, and then you have that ischemic event where now you have some serious consequences. So this is now in comparison to the hemorrhagic stroke. So this is, it's 20% of the strokes. Uncontrolled bleeding in the brain. And this actually, I'll just put this up here, because it's a very similar idea, is that once you have a loss, once the blood is leaking out from the arteries, it's not going to the proper place, it's flooding the brain, and then it's killing brain cells. So blood, in fact, when it's not in the right place, it can also bring in these immune responses, and those immune responses, those inflammatory processes, will try to clean up the blood. As they're cleaning up the blood, they're in fact having a secondary effect of destroying brain cells. And there's this whole cascade that I'll try to get into a little bit, but I don't want to get into too much detail because I don't want to get lost in the details of what's really happening when there is this stroke event. So the subarachnoid hemorrhage is essentially what's shown here. So we haven't gone too much into the bigger anatomical organization of the brain, but you do have this protective layer. When I tell my students, I say it's like a leather coating. So you have your skull, which is the armor, and then underneath you have this leather coating, which is a secondary sort of protective mechanism, and that's what's it's essentially called the dura mater. So it's this protective coating, and then there's fluid in there, the cerebrospinal fluid. But you can see all these blood vessels that course through that leather coating, and what you can have is a bleed right there. So it's sort of outside of that protective coating. So it's not necessarily going to get into the brain and produce damage like what you'd see in this hemorrhagic stroke, where that's right in brain tissue, and that can cause this, the flooding of the brain, killing brain cells. But the problem with the strokes that are happening outside of this coating is that there's pressure buildup. So it's that pressure buildup that then, confined, or because the brain is confined in the skull, the pressure buildup will then cause damage, and that's where, any pressure buildup in the brain is obviously can cause some serious outcomes, and that's where you'd have to go in for a surgery to reduce that pressure to pull out that blood, and then fix the break in tissue, or the break in the artery. So that's the difference. That the intracerebral hemorrhage is the one that is happening within the brain itself, on the brain tissue, and the blood is actually having kind of a toxic effect on the brain cells. So they often come from an aneurysm. So again, as the blood vessel, or the artery wall is actually weakening, let's say, it can then burst, and that will lead to blood leaving the arteries and then infiltrating the brain tissue. So again, what are some of the risk factors? High blood pressure is one that can do that. Uncontrolled bleeding. So, people are always pushing the idea about taking aspirins to reduce, blood pressure, to help with all, I suppose reduce blood pressure. But what that can also do is if you do have a break in your artery, the blood will just keep going out and out and out. So the uncontrolled bleeding could actually be a secondary effect of this, of a really good circulatory system. So a hemorrhagic stroke, so this would be an intracerebral hemorrhagic stroke. So you have all these vasculature that infiltrates all the brain tissue, and then you have essentially, let's say maybe an aneurysm, which will cause a burst in the arterial wall, and then the blood will leak into the brain tissue. And as I said, that can often then bring in all these immune responses, inflammatory responses that are meant to clean up the blood, but ultimately what they do is they release their own toxins and they start to destroy blood tissue around there. And then the other one is if you have stroke outside of that leather coating, that will cause pressure to build up and it will sort of compress all the brain, and then that will also lead to its own secondary set of damage. So what are the signs and symptoms, or the stroke warning signs? So again, this is something that the Heart and Stroke Foundation of Canada has been pushing. There's all these ads on TV about that. Essentially weakness, trouble speaking, vision problems, headache, dizziness. So a lot of this, I think, which is interesting though, is as to why those are coming out. So what is the reason for those symptoms to appear? What are those warning signs? Why are they being there? And so you can imagine that essentially what's happening is it's an indication of where the stroke is taking place. So if you have trouble speaking, it's probably because you have a blood clot or bleeding in the part of the brain that's responsible for language production or speaking. If you have vision problems, it's probably because you have a blockage of blood flow that's going to that part of the brain that underlies visual processing. Headache is a bit more of a challenge because, again, we all are experiencing headache. So a headache can just happen because it's a change in blood pressure, a swelling of the blood vessels, a swelling of the arteries, or a constriction, or there's a lot of different ways that a headache can come about. And it could come about because of, let's say, a mini stroke, and nobody would ever think twice about it. But so I guess in this case, as they say, I think this requires a bit of a qualification: sudden, severe, and unusual headaches. So maybe one of these really, severe headaches. But what happens in this case is that oftentimes people will have these severe headaches, and they'll think, oh, I just need to go to sleep. They go to sleep, and they actually end up having a full-blown stroke in the middle of the night. So this is one thing that always really kind of disturbed me about these signs and symptoms, is that something like this could be overlooked as something that's just minor, but it could be an indication of something that's very serious. So, but anyways, the point of this is to, when you see these signs and symptoms, obviously call 911. There's a treatment that, will, because most strokes are because of a blockade, so they'll give you a clot buster, and that will hopefully remove the clot and then prevent further damage from happening. So we'll get into that as we move along. But the thing is to, when you see these different signs, it's an indication of where the stroke is actually happening in the brain. So I think that's the part that I want to kind of, make sure to focus on. But first, we'll go to the microstructure damage. So what is really happening when blood flow is interrupted to the brain, or blood flow is disrupted to the brain? So we have what's called the Ischemic Cascade. So again, I'm just focused on this because I think the 80% of strokes are based on a blockage, but this cascade, or this post-stroke damage cascade, I guess would probably be a better way to put it, happens in both hemorrhagic and ischemic strokes. So there's this process that takes place that, again, the more we understand it, hopefully we can devise better treatments for a stroke if you miss that window of opportunity for the clot busters, basically. So when you have a blockage of blood or a leaking of blood, brain cells lose their ability to produce energy because there's no oxygen being sent to that part of the brain. So again, I think this is interesting. So thinking of the brain as a muscle, I know the brain is not a muscle, but it does have some similar properties to muscle. So when a brain cell loses its blood or oxygen input, it actually switches to anaerobic metabolism. So just like as you're running, as you're exercising, your muscles start to, the blood isn't flowing there as quickly as it should. So they switch to this anaerobic mechanism, and then lactic acid is released. So that happens in your arm muscles and your leg muscles. It happens in your brain as well. This lactic acid starts to get, released, and that is actually toxic to the brain. So, clearly one way to treat maybe a stroke is to give some enzyme maybe that can break down lactic acid, which I didn't see any evidence that would suggest that as a viable treatment, but it's possible that this could be something to look into. So another part of, I was thinking about this in terms of this class, so I've always been talking about the frontal lobe as a really important part of the brain, as what makes us humans. It's also very, susceptible to damage. So at the really microstructural level, that's really important for brain function is calcium. So these calcium ions. So there's a particular balance that the brain needs. If you get too high, calcium is toxic. If you get too low, calcium is toxic. So you have to have this really perfect balance for everything to work properly. And as I said, our lives revolve around our frontal lobes. Our brain's life revolves around calcium. So what can happen during this ischemic cascade is these calcium levels become too high. And then they start to release other, excitatory neurotransmitters. They start to, in fact, set off signals that will just completely destroy the neuron. So there's a question that I thought about, and this is actually relevant, about using nicotine to stimulate neurotransmitter release. What nicotine does is it activates calcium to go into the cells. So if you have too much nicotine, too much calcium can get into a cell and actually cause this neurotoxicity. So that's one reason to not take nicotine before, to enhance your brain processes. So excess calcium entry can overexcite a cell and set off this cascade where it becomes destroyed. So again, another way to potentially treat a stroke after that window of opportunity that a clot buster will not work is to stop this calcium change, so to give calcium buffers or to block these excitatory neurotransmitters that will then stop further calcium entry. So this is where I get into some of the, again, I don't want to focus too much on this because I don't want to get lost in the detail of the bigger picture about what a stroke is doing, but I think it's worthwhile to just point out about how, again, normal brain function works. So in a normal brain, this is normal synaptic transmission, what you have are two ends, check out my silly putty again. You have two brain cells that are not physically connected, but are very close in association with each other. So you have the axon from one and the axon terminal, or the end, connecting to the dendrite of another one. So this is a dendritic spine, which was in the first, I'd mentioned this microstructure, this dendritic spine. So if it gets to a very, very small, minute detail of the brain, but normal transmission, so again, you have cell A, let's say, and cell B. Cell B doesn't look so good. So they're very close to each other. The way that they communicate with each other is to release chemicals across this gap. So the chemicals will jump across and they'll bind to these receptive units on the other side, so on that dendrite. So this neuron will spit out its chemicals, it'll jump over here, and then there's a process that people say is kind of like a lock and key. So the key is this chemical comes over here, fits into its lock, opens it, and in this case, when you have this excitatory chemical called glutamate, when that binds to its receptive unit, what happens is calcium comes into the neuron. So these allow, I don't even have it here, but these will allow calcium to come through that pore, through that opening when the neurotransmitter is bound, and then calcium can do its thing. So so calcium is not always bad. Calcium is in fact very good, so that's why I have the good and the bad of calcium. So when we're learning something, we want calcium to be coming in. This is totally way too complicated, but what's happening is when we're learning something, that excitatory chemical is being released from this cell A. It's jumping across, it's fitting into its lock, it's opening the door, I guess, and calcium is now coming into this receptive neuron, and it's setting off all these chemical processes, all these biochemical processes, all these genetic changes that are essentially telling us that there's learning taking place, and it facilitates us to remember things. So this is, in fact, long-term potentiation is just another word to say learning at this level of detail. So calcium, we need calcium to come in for us to learn things, but it can only be a certain amount, right? So that's where calcium is good.